hosting today's webinar. I'm Kaustubh. I'm also a clinical psychologist, but today I got the opportunity to host the workshop. I am working now as a moderator between the trainer and all the participants. So I welcome all the worthy participants on the fifth class of Mega Training Program. I'm shortly introduce the Royal Psychological Community to all the participants that you already know about the Royal Psychological Community, but let me again clear you what is the purpose and what is the role of Royal Psychological Community. Royal Psychological Community is the registered psychological community that is organized short webinars, online short courses, certifications, and conferences. Royal Psychological Community is internationally verified, works with the GIOC and ICCP. The main purpose of Royal Psychological Community is to raise the awareness about mental health problems. So, Royal Psychological Community is performed its best to raise the awareness among people. A lot of short workshops and webinars are daily conducted by Royal Psychological Community. So I am introduced the today's trainer, Dr. Maria Anwar. She is the clinical psychologist. She is NLP practitioner and Reiki master, RFT practitioner, and mindfulness trainer. So I am further sorry. Dr. Maria is here and she is start the today's workshop. I am giving it to Dr. Maria Anwar. I guess all the participants are present. Yeah, all the participants are already joined. So I hand over today's workshop towards Dr. Maria. Dr. Maria, please continue. Dr. Maria, are you here?
Ma'am, could you hear me?
Yes, yes.
Assalamu alaikum. Hey, it's Dr. Marian Khan, and thank you very much, ma'am. You introduced me very well. And today we start our session regarding emotional freedom technique. Might be you heard about this one thing before also. And this is
Yes.
basically neural linguistic programming, NLP. This is a technique of NLP, basically. In this we can deal so many problems, even then psychological, you can say that physiological, because each and every physiological disease is each and every physiological symptom basically based on emotional issues are there, emotions are over there. And when we overwhelmed of that when emotions, automatically what happened, we face any kind of disease, any kind of severe symptoms which can, you can say that, effect on our functioning. That's why this emotional freedom technique, that is really very good. You can apply on any one person, and you will see very good results over there. I have applied so many patients, and even till 1000 patients I counted, but after that I didn't. And till 1000, alhamdulillah, alhamdulillah, all were recovered. They felt that there is difference before and after. This technique basically given by Craig, 1995. Um, Ma'am, there is another thing is coming. Kindly, could you open slide?
Yes. I- I'm going to share my screen with all of
Okay,
you.
ma'am. Okay, ma'am is opening, but first of all, this thing is that I want to teach today about emotional freedom technique, how we work with it, because basically, I want to tell you this is really very beneficial, and it put effect on each and every disease, if, except death. Means it is really a marvelous one. Even then, when I was applying, I was in hospital, and there was one patient came with cardiac issue, and there was no doctor at the time because it was not emergency, it was just clinic. I applied on that person this one therapy, and I shocked. Mashallah barakallah, that person recovered. And I was astonished, means it could affect over there. That's why I just want to tell you, because this screen is not showing to me. That's why I just come on that point. How this technique could we do on others and on ourselves also. For this technique, few tips you must have in your mind. Number one, whenever you are applying this one technique, you must ask each and every symptom, each and every cause. For that reason, symptom, this disease started. For example, you say that you want to work on weight loss. Why weight increased? According to the client, you have to ask. A client will tell because of foodie, because of this one thing, because of emotional disturbance, anything. You have to write each and every symptom over there. And then you will say, rank your each and every. Yes? Yes, ma'am?
I'm sharing my screen. I am sharing my screen. Can you please check? My
Yeah,
screen
little
is
bit.
visible to all of you.
Now it's opening, but it's wide. I could not. Yes, now it's okay. Now I can see.
So
Okay.
that's okay.
I was. Yeah, it's okay. Thank
Okay.
you. Okay.
Welcome.
I was telling you, when you are going to apply this one technique, first of all, you have to take all the symptoms. You have to write all the symptom of that one disease, why this disease started, what is the emotion behind it, how person feel it. And after writing each and every symptom, you have to give ranking of that thing. You will say to your client, even then you can say to yourself also, and I want, you must apply this with me, and you have to show me your results, because each and every person has different symptoms. Each and every person has different, you can say that diseases and whatever it's in their mind. You can apply. You don't tell me, but you have to apply yourself, and you have to tell me over here, are you feeling difference over there or not? First of all, again, I'm saying that you have to write all the symptoms. If yet you have no time, just pick up one symptom and see the difference. I'm not saying that that difference could be very large and difference is minimum. It is up to person. It's very person to person. When you have to write all the symptoms, then you have to give ranking. 0 means you have no disease, you have no that kind of disorder, but 10 means this is maximum, means you can say that this is limit, but this is limit. Now it could not exceed to this one. You have to give one mark to your disease, 0 to 10, and then you have to start EFT. You have to say, I'm saying you, there are some parts you can say that it is just like a burger. This technique is based on burger, means sandwich part upside, sandwich part downside, and there is between we are putting, you can say that shami and this and that, like that this technique is also. But understanding one and understanding to this disease, first of all, you have to understand that this technique basically utilizing your brain, your emotions, means your heart, and your words also. Your 3 things are working together. That's why whenever we are saying we have to take name of any disease, for example, any person, cancer patient has cancer, and that person say cancer, cancer, automatically that is bringing very bad feelings, and we don't want to take that one name. But in this time, we are taking that one name, and at that time also we are working on it with another things, mean verbally we are working, mentally we are working and heartily we are working, and our body is also working. That's why at that time we could not put our emotions over there, and we take it for granted. Our body take it for granted, and at that time our those emotions released, which are basically making cancer, or which are basically making weight or increasing emotions. You can understand it like that one in one example. For example, when your LED is not working properly, you call electrician, please come and look over there. What electrician do? For example, that person is touching each and everything. When that person is touching LED at the time, which thing is working good, automatically it will work good, and which is not working good, only that person will diagnose it's not working good, and at the time it will correct it. When we will do this one therapy, because it is like a tapping, we do with it tapping also. With tapping we are searching that one emotion. Where that one emotion is not there, it will not affect, it is mind and body automatically work. And where this emotion is stored, automatically that thing, when we are working, it will be starting to go out, blood flow will be increased over there. You can say that blood flow, it will be just like that. You say that tube, for example, a water tube, and if there are bubbles, or you can say that greenery or something else is over there, due to those bubbles, water is not going very quickly outside. At the time, if we put pressure over there on the rubbles, automatically what happened, water flow will be very increased, and rubbles will leave their position and they will go forward. Like that our emotions will resolve gradually, and in the last it will be resolved. We will take one emotion in the one time, and we will apply that one therapy till that emotion comes till zero. Because this procedure will do again and again, it could take time. It could take 45 minutes, or it could take less time also. It's very client to client, I told you this. It is up to client. That person's body tells that it's going to decrease quickly, or it is going to decrease gradually, those numbers. Now we started. I told you there are sandwich means upper portion and down portion. Then between there is you can say the burger shami over there. First there is this one portion, because this is basically karate chop. We will start from here, and here we will tap, because I told you this is basically emotional freedom technique. At the time there are basically pressure points in this therapy. We will tap on the pressure points, and with mouth we will speak. Our mouth will work in speaking, our hands will tap on that one pressure points, and after that one thing. And in this one thing is that we will count later on also. Our brain, our heart, our hands, and our mouth all are working together. That's why whenever we will take that one emotion, our emotion just will go out as casual, but inside our body is working on it. For example, I am saying that any kind of disease or any kind of symptoms, I don't know your symptoms, just I take weight, mutapa, whatever is coming in your mind, you can take that one symptom, that one disease. You can say depression, you can say grief, you can say anger, you can say stress, anything. You have to mark 0 to 10. Okay, now you have to start from your karate chop. In karate chop you will this is your karate chop. Look, this is bay line, and on this bay line you will tap on it. But you can tap so many times, it is up to you, but you have to speak 3 times. You have to speak 3 times one phrase which is going to locate that one emotion. For example, you will say, even though I am a fatty, I accept myself as I am. Like that, I have said fatty. You can say any kind of symptom over there. You can put your symptom. Look, when you are going to tap on it, you are feeling vibration also over there in your hand somehow, because it means you are tapping on the right part of the pressure point. Sometimes you forget, or sometimes you could not touch that one pressure point. Does not mean it doesn't affect. If you will touch, automatically it will affect. If you will not touch, it will not affect. That's why there is no hazards, there is no disadvantage. Just you take it very easy and relaxing therapy, which is very beneficial for you. Okay, we start. For example, I have 9 point. I have fatty. I will say, even though I accept myself as I am. I will say this one phrase 3 times. Second time, even though I am fatty, I accept myself as I am. Again, I am saying, even though I am fatty, I accept myself as I am. You can say in your own language also, like that. I am Urdu speaking. My national language is Urdu. I will say, अगरचे मैं मुझे मोटापा है, लेकिन मैं अपने आप को कबूल करती हूँ, मैं जैसी भी हूँ. आप अपनी लैंग्वेज में भी कह सकते हैं, and you can say in the language also which is acceptable for you. 3 times you have said this one thing, okay, and now you have start from your head till your fingers, and again head. This one is total circle. Okay, this one from you can say that this one area from here head, and it is going to back side of that. From here you have to start tapping. Now you will count it. You have to count, you have to tap approximately 7 times. Sometimes it is go to more than 7, and sometimes it's less 7. It's okay, but try to count, because you want to make busy your brain, your heart, and your you can say that mouth and your hands. You have to work with all your body. That's why you have to count. Otherwise, if you are not counting, it's okay. But for counting, that is because we don't put our attention on our words, our disease. We just want to make it casual. That's why we will say mutapa, mutapa, yeah, fatness, fatness, fatness. I have to do tap over here 7 times. I have to count 7 times, and I will same. It is up to me how many times I will say that one phrase, but I have to count 7 times tapping. Again, I'm showing you. I will say fatness, 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 fatness. 7 times I counted in my heart. From mouth, I said that fatness, fatness, fatness. Okay, somebody say that said me I have to speak in Urdu. ओके हम लोगों ने यहाँ पर इसको मोटापा मोटापा कहना है, और यहाँ पर 7 टाइम्स तक 7 दफा हमने इसमें टैप करना है. अब हमारा यानी कि पूरी बॉडी में जो हम प्रेशर पॉइंट्स हैं, क्योंकि हमारे यहाँ पर हाफ तक ये प्रेशर पॉइंट है यहाँ पर, तो मैं अभी आपको सारे प्रेशर पॉइंट्स बताऊंगी. उन प्रेशर पॉइंट्स पर हमने 7 टाइम्स तक टैप करना है. वो 7 से ज्यादा या कम हो सकता है, उससे कोई फर्क नहीं पड़ता, बट हमने 7 टाइम्स तक टैप करना है, और मुंह से हमने फ्रेजेस यानी कि वो वर्ड बोलना है जो बेसिकली डिजीज है या सिम्टम है. आफ्टर दैट यू हैव टू कम योर दिस वन आईब्रोज, और यहाँ पे आपका प्रेशर पॉइंट है, और यहाँ पर आपने इसी तरह से इसको करना है. आपने वही 7 टाइम्स तक टैप करना है, और आपके मुंह से जितनी दफा मर्जी वो फ्रेजेस निकले. Mutapa, mutapa, mutapa. 7 times I tap. There are 3% raises hands. Okay, then other thing is that, ma'am, could you open that one slide where are these basically points over there?
I'm opening the slide so you can
Yes.
see which one. This
Previous one. Where is
the 5.
previous one, ma'am? This one.
This one.
Yes, that's
Okay.
one. Thank you. And end of the eye. This is also have pressure point. End of the eye. you have to put two fingers. Why? You can tap with one finger also. आप एक फिंगर से भी टैप कर सकते हैं, लेकिन आप दो फिंगर से क्यों टैप करें? क्योंकि उससे हमें यह है कि माइट भी हम उस प्रेशर पॉइंट पे हाथ ना लग सके एक फिंगर से, तो दोनों फिंगर से करना, और इतनी जोर से नहीं दबाना कि दर्द हो। आपने उसको रिलैक्स में, बल्कि थोड़ा सा इनकी लिटिल बिट स्ट्रेस जो है वो देना है। तो 7 टाइम्स यहाँ पे भी काउंट करना है, और साथ अपने अपने डिजीज या सिम्टम्स जो है वो आपने बोलनी है। जैसे मोटापा 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 मोटापा, आई हैव डिड 7 times. Okay, then under the eye 7 times you have to tap, and so it's up to you how many times you say this one phrase: fatness, 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 fatness. Then under the nose, this thing, one finger you have to put, and here you will say fatness, 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 fatness. And then under the lip, on up your chin, this one, two fingers you have to put over here. Mutapa, 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 mutapa. 7 times you have to tap over here. Then you can see over there, there are basically neck bone,
comments of the
or
I think
this neck bone there is
Adi.
V, and 1 inch down of that one V, you have to you have to tap over there. This is basically pressure point. You have to, you can locate over there V. There is your neck bone. From your neck bone 1 inch down, and there is basically pressure point, and you will say, or you can say that collarbone or neck bone. It is up to you. And here you have to say and tap it again 7 times, and you have to phrase that one word, like mutapa, 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 mutapa. You can
Miss
use your
Maria,
both. Yes,
I'm just reading the
yes.
comments of the messages. So आप एक बार पूछ लें बच्चों से कि that everyone is clearly heard your voice. Has everyone heard the voice of Dr. Maria?
Yes, ma'am is audible.
Okay.
Yes,
Have
please,
you
loud and clear. Although sometimes the language we are not, some of us we are not getting it. Thank
we
you.
are not you are not getting the voice or the language concept?
No, the voice is very clear, but sometimes she's using language which some
Urdu.
of us in Africa we are unable to
Okay.
Okay,
understand.
okay, understood.
Okay.
Thank
The
Okay.
thing is
Okay.
that here was the message. Sorry, sir. Here was the message. There was written you have to speak in Urdu,
Yeah,
which is our national
that's fine.
language. That's why I started in Urdu. Now I will speak in English.
Okay. Is any there another question by anyone?
Yeah, I have a question.
Please ask.
Ma'am, can you walk us through the basic steps or techniques of EFT, or can you let us know about the potential limitations or contradictions when using EFT?
I told you there is no contradictions. This is really very good one, and you can use anywhere, and really it is like a deep breathing exercise. You can say that there is no contradiction.
Okay, if there is no contradiction, so are there any limitations to it?
No, there is no limitation. Just one thing is there. You have to write your all symptoms first of all, because this therapy is saying that when you do it all on all symptoms, that disease has very less. You can say that think it come back. Otherwise, it will not go come back. That one disease means it is really very effective, and I have observed, I have, you can say that applied many times. I apply on myself many times. But one thing is there, you have to work on all symptoms, and you have to take one symptom one time.
All
Even
right,
then,
ma'am.
if you're a psychology students and you want to apply systematic desensitization, and really it's marvelous. I applied it over there also. Even then, I applied it on phobia. I applied on so many, you can say, that symptom and diseases, and it has miracle. It is miracle, really. It is really very effective.
Okay, ma'am. Thank you so much for the answer.
Most welcome, dear.
I have
Ma'am,
a
I want to
confusion
ask a
actually.
Yes, sir.
Ma'am, the confusion is, let's say we are focusing on one symptom and we are starting from we are naming it 7 times, and we are starting to tap on the points you have mentioned. How about the process that is before this? So I wasn't able to understand the the process you elaborated before this. I mean, pre-step.
Okay, sir. So it is really very easy. First of all, you have to inquire that one disease, that one disease, how many symptoms that has, and what was the cause, what was the reason of that one disease. All these things we have to put over there. Then you have to ask from your client. You have to give ranking 0 to 10. 0 means it is not nothing is there. It is not disease for you, and tens mean, oh, it is so much, it is means extreme over there. Minimum to maximum you have to put on each and every symptom you have to put.
Ma'am, I have a question.
Or it is up to you, you can take one symptom and on one day you will work over there. After that you
Ma'am,
will tell. Yes.
Ask the question.
um, ma'am, I want to
Correct.
ask a question regarding EFT.
Yes.
As you are also a Reiki therapist, I'm also a Reiki therapist. Currently, I'm pursuing master level of Reiki therapy, and in that, I will study acupressure Reiki as well. So, ma'am, I want to know that how, like EFT is also doing the acupressure thing, and in Reiki Master, I'm also studying
Yes.
acupressure thing. So, okay, so I just came to know the one difference between the EFT and Reiki is that कि Reiki is an energy healing thing, okay? And
Yes.
EFT, like how it is from Reiki.
It's not from
Can
Wiki.
you
It is basically neuro-linguistic programming. Neuro, brain, linguistic. You are working with your mouth, your tongue, your language, and both are going to program in your brain, and it is going to change that one thing. Because few words are making us hazard, fearful, and a few words are making us happy, like this it is
Yeah.
working over there. And Reiki, that is different, it is healing procedure. And for healing procedure there are some acupressure points, and there are 7 acupressure points where we have to give Reiki and we have healed to them. But these pressure points are basically those pressure points where our veins are going to make junction. Means you can say that that is junction, and from there blood is going to flow on different ways. Different you can say that there are ways and where is going blood. When there is going to blockage due to that one symptom, because we know that our unconscious mind is our whole body, and
Yeah.
our emotions regarding to that disease is going to store anywhere. And when they are going to store anywhere, we don't know where is it. We check it. We check it through tapping, and we are tapping over there, and through mouth we are saying we are uttering that one disease name. But because we are busy in counting also, that's why our mind is taking it casually, and we can easily locate it. This is work of our brain that is going to locate, and that work is also working to resolve it when it is going to locate. That's why it is emotional freedom technique, that emotions going to resolve gradually, and automatically it will be finished when our blood flow will be good over there in that one junction. You can see it biologically also. Even then different things you can apply. Really it is scientifically proved also uh, that there is difference between Reiki and this one technique.
I
Understood?
want to ask,
मैम
Yes.
that part
आप प्लीज
correct.
एक दफ़ा शेयर दोबारा से ये जो आपने स्क्रीन शेयर किए हैं आप दोबारा से बता सकती हैं मेरा कनेक्शन प्रॉब्लम हो गया
If,
था
the thing is that if I complete one time, then you can ask it, because I think so we have to complete one time that procedure. And then you have any question regarding this one thing for repetition or anything, I think so we have to complete this one thing